Hey guys, EMD here. Hey, I'm glad you tuned in because today we're going to be talking about the recent left-sided shoulder surgery that I had. I had a left-sided posterior labral tear, so we're going to talk a little bit about shoulders today. If you or anyone else wants to know a little bit of information, maybe is considering shoulder surgery, we're going to be talking a little bit about that in this video. So if you're new to the channel, make sure you subscribe, turn on the bell notifications to be notified whenever a new video drops. Let's get to it. So just some basic definitions real quick. A dislocation is when there's a complete displacement of the humeral head out of the glenoid. So that's this arm bone that you have is the humerus. When that completely comes out of the socket or the glenoid, that's what we refer to as a dislocation, okay? It sounds painful, it is painful. Now, a subluxation is whenever there's a translation or movement of the humeral head relative to the glenoid surface without an actual dislocation. I think that's what I had whenever I initially had my injury, and I'll talk about that a little bit later. But first, let's talk a little bit about what the glenoid actually does. So the humeral head basically articulates with the glenoid and is held there by a bunch of stabilizers, okay? So you've got a bunch of glenohumeral ligaments, you've got the glenoid labrum, which is kind of like a suction cup, and really it holds that humeral head in place so that it doesn't pop out, it doesn't dislocate a bunch of times, okay? It really functions to give you stability. Now, you've also got other things like your rotator cuff muscles, you've got the long head of the biceps brachialis, and all these things all play a role in keeping your glenoid and your humeral head stabilized, and it allows you to perform all these amazing movements that we can do, okay? All that stuff. So last week, I ended up getting shoulder surgery on my left side, okay? I had a left-sided posterior labral tear, and this started back in 2018. I remember distinctly when I was bench pressing with, again, it was probably shitty form. I was, my elbows were flared out like past 90 degrees, and I was ego lifting, and basically I felt a little pop at the bottom of my movement, and that is when I frankly knew something was off. So I got it checked out, I got an MRI, and I had a posterior labral tear, sure enough. So that's why it's so important. I tell you guys always all the time, make sure you pay attention to the form of all the things that you're doing in the gym, because you can really hurt yourself. We don't want that. So anyways, I ended up feeling a real clicking sensation, a popping sensation, and ultimately after that, I noticed that whenever I would try to abduct or pull my arm away from my body, I would feel more unstable in certain things. And it wasn't just an exercise at the gym, but things like swimming and just all kinds of other movements where your arms are kind of forced to be in odd positions. I was very compromised in that kind of stuff. Now, I can already tell you this, but posterior labral tears are not nearly as common as anterior labral tears. And most of the time, people have things that cause anterior shoulder dislocation where the head of the humerus kind of falls forward, and a lot of those things are like slap tears. They're super common in young active people or overhead athletes. Some of the other conditions are like things like Bankart lesions, which occur whenever there's a fracture of the anterior inferior glenoid, when there's impaction of the humeral head against the glenoid. And there's things like Hill-Sachs lesions, which basically it's a compression chondral injury of the posterior superior humeral head after impaction against the glenoid. Those are other injuries. You can definitely look more up about those online. Now, I think that labral tears are not to be confused with rotator cuff tears, and those have a lot more impairment on your functional day-to-day life, and they have a longer recovery time, a longer surgery overall, and they're a little bit more of a serious surgery than, your labral tears. So ultimately with me, I tried to do a lot of conservative management with rehab. I strengthened my rotator cuff, my posture, all that kind of stuff to the best of my abilities, and I still would experience some pain doing things like wherever you were on the, for instance, like the rear delt machine, and then pushing on some chest press type machines, things like that. I would just notice some discomfort, and ultimately I talked to my surgeon, and he said, look, it's just an elective procedure, you can go ahead and do it. And I decided, you know what, I'm gonna go ahead and follow through with this. After a couple of years of conservative management, I want to mentally feel like I'm not handicapped in any way. So a lot of it was a mental thing too, because 85% of the things that I do in my day-to-day life, I could do. So I actually went in the morning, I did the surgery. I think he got it done in like 30 minutes or so, and I was done post-op at noon. Actually, I think there's a video of me post-op with all the anesthesia drugs in my system, and I posted that on TikTok, and I think I was just encouraging you not to like ego lift or something like that. So I'll leave a link in the description. For now, I'm approximately 1 week post-op, and I'll try and consistently post to let you guys know about my progress and my experience within the next several weeks and months as it relates to the surgery. Ultimately, my goal is for the first 6 weeks, I just want to improve and get comfortable with my range of motion. And my surgeon's instructions were not to hold anything heavier than a coffee cup in my left hand for the first 6 weeks. But, you know, that's why I said it's so important. Like I said this like 10 times, don't ego lift, and make sure that whatever you're doing at the gym, you do it with the right form, okay? Now, I've seen studies that talk about how a lot of people have labral tears and are asymptomatic, and I think that's great. If you have a labral tear, and a lot of people, like for instance, overhead athletes have these, then it's not a cause for concern. If you don't have any pain or any symptoms, then I think the best thing is ultimately just to strengthen your rotator cuff muscles, maintain good posture, manage it conservatively. You don't want to choose surgery if you don't have to. There can always be complications, and I would just recommend always trying conservative management first. Now, if you continue to have pain and you fail the conservative approach, then obviously the next step is surgery. Now, do I recommend that you have surgery if you have a labral tear? And the answer is it depends. I can tell you that for me, I tried the conservative approach for a couple years, and while I was okay with 85% of the things in my life, there was still a small amount of fear in the back of my head that because of my injury I can't do this and I can't do that, and it became somewhat frustrating for me and limiting. And really, I just talked to my surgeon and we decided that, okay, let's go ahead and proceed with surgery. It really depends on your life. Like, what kind of activities are you likely to engage in your day-to-day life that give you a decent quality of life? Or do you have pain? Do they require the use of your arm being in certain positions, lifting heavy things overhead? Ultimately, I think the thing is, do you have a lot of discomfort or pain? And if the answer is yes, if you have a lot of persistent discomfort, pain, you have a lot of instability in your shoulder, it's definitely worth talking to an orthopedic surgeon. Hopefully, if you're an athlete, then if they're sports trained, they probably see a lot more of your age demographic than some of the geriatric patients. They might be able to offer you some more individualized advice based on other athletes that they've worked with. I'll let you guys know how I'm doing with my progress. For now, I can actually raise my arm. I'm a little over 1 week, by the way, so I can raise my arm here. I don't have any pain actually, and I can go out to the side too. There's mostly with external rotation, so like moving my arm this way, this is about as much as I can go. Labral tears generally have a very favorable prognosis. I think 95% of people regain their ability to engage in whatever form of activity that they were in before. Sometimes some people say they're even stronger than before, but ultimately talk to your surgeon, get an MRI, and see someone who specializes in these types of things in sports injuries. One of the other concerns that I had with my surgery post-op at least was that if I start, engaging in ranges of motion too early, is that gonna mean somehow those screws or anything will come loose? And he was like, look, I hammered those anchors in so well that even if I tried my hardest to pull them out, they ain't budging. So that was one thing that I think might be worth knowing for you guys who end up getting this type of surgery. The other thing I would say is post-op, it is important to still try to get your range of motion back, because the cases of frozen shoulder or adhesive capsulitis, I think sometimes when people get these type of complications, it's because they wait too long. I mean, I know it's a little bit uncomfortable immediately after surgery to move your arm around. I get it. But if you don't do it, you kind of lose your ability to do it, and then anytime you try to do it, it becomes really stiff and painful. So make sure you do try to mobilize your shoulder, I would say, a little bit and increase your range of motion sooner rather than later, because again, we don't want to have all that stiffness. And that's just my thoughts. I mean, talk to your surgeon about what you think might be best. And that's one of the reasons I actually haven't been posting as frequently, along with just busy rotations. And I've also got some more studying to do because I have my board exams coming up. I'm also in the process of closing down on a home, so it's gonna be my first home, and maybe I'll make a future vlog for that. Also, I signed my first contract for my job starting as a hospitalist in September. Thank you so much for all you guys who have been supporting me, and I'll see you guys in the next video. Keep being a boss.